Welcome back to our regular viewers, and thank you for joining us for our third episode of the season. This podcast is for behavioral health clients and consumers, advocates, allies, peer support workers, community health workers, uh, and community stakeholders, where we talk about advocacy, peer support, and provide education related to legislative changes, to statewide policy to empower you as a client, consumer, or ally to lift up your voice as a stakeholder in the public behavioral health system. With me today are my incredible Access California program teammates.
I'm Jocelyn Farrell.
I'm Grace Gallagher.
And I'm Nicole Chilton. If you are new to our podcast, a new peer ally, or new to the workforce, we're glad we found you. The Access California team was on the road last month, and we're coming back filled with gratitude and enthusiasm for our next 4 regional behavioral health transformation workshops. The first workshop of the year took us to LA, and to make that happen, we relied on our LA LLEs, Painted Brain, and mental health advocacy services. So we want to thank them for all their support from planning to outreach to help with registration. They really helped to make it a wonderful day full of really great conversation. We also want to thank the California Endowment in downtown LA. They hosted the event. They have a beautiful campus, and were so very helpful to us from planning with the catering and our audio, visual, and sound, everything. They just really provided an all-inclusive day for us to be able to make it a pretty easy event for us.
Yeah, thank you so much. Really emphasis on our LLEs. Angel at Painted Brain got employees and a lot of her students there. So that was great. And then Eric, I'm sure at MHAS has now had a lot of people asking him for help with some of the legal stuff. So yeah, just emphasizing their help. That was really special that day.
It really was. I know when Eric was able to add to the conversation, add his expertise, we really found that individuals were ready to connect.
Everyone was like,
Here
there's
in
a
the
lawyer
room.
in the room.
Yeah, exactly. Um, and Angel's so connected to the community. And so seeing the number of folks in the room that are impacted by the work that they're able to do at Painted Brain just really shows how vital these resources are to the community.
Absolutely.
So let's share a little bit about the background of the behavioral health transformation workshops. We wanted to take a look at the state's effort to modernize the public behavioral health system, starting with the Mental Health Services Act, also known as MHSA, to the Behavioral Health Services Act, known as the BHSA. So this also included looking at the California Advancing and Innovating Medi-Cal Initiative, known as CalAIM, and the California Behavioral Health Community-Based Organization Network of Equitable Care and Treatment Initiative, known as BH Connect. That is always a mouthful, trying to get that out. A lot of our acronyms are that way.
Yeah.
So the day really was going from how did we get here to where we are now, how this impacts client consumer operated service providers and peers, and where do we go from here, really? What that was a main question whenever we're talking about this transformation is what do we do? And the peers are always ready to show up with resources, connections. I'm going to this meeting. We're having this conversation within my organization. And so, speaking of those peers, we had an incredible turnout in LA with a robust conversation throughout the day, during our breakout activities, and questions raised. even after the event, folks who were staying behind and trying to connect and still reaching out with emails. We had over 40 participants, and that's huge. The room was full, it was packed wall to wall. And so we were just really incredibly grateful leaving there with the energy that we felt, the passion, and folks really um, leaving with empowerment to move forward from where we are now.
Mhm.
And so some of the organizations we saw there,
We had quite a few organizations from LA County, from the surrounding areas. We had a number of individuals that came from Trans Latina Coalition, from Pacific Clinics, from Masada Community Health Services, Step Up, Victor Community Support Services, Department of Veterans Affairs. And that's just a few. I wish I could name them all. We had so many people, so many organizations represented. So if you were an individual that were there or your agency was represented there, we're just so grateful that you came and took the time to be with us and join us for the day. And we also had a number of people that weren't necessarily there from a particular agency. Some of them might be retired or they're currently students, but are still really powerful advocates in the community. So for everyone that showed up, we're just grateful that you came, brought your passion, your expertise, and joined us for the day.
Yeah, totally.
that expertise, that lived expertise, the shared expertise across everyone in the room was definitely palpable. And I know looking ahead for us as a team too, just really makes us excited for the upcoming events. And so as we navigated through the day, peers, as we mentioned already, were sharing their personal and professional lived experience of navigating the public behavioral health system as it is now. And so recognizing that this transition is going from a client centered to more of a medical model in the BHSA, we had a lot of feedback from the folks who were there in the room, willing to share their voice. And so we are looking ahead with the information that they brought to the table, and figuring out how we can continue to incorporate their stories within our advocacy efforts here with Access California and Cal Voices.
Yeah, I think for me, the biggest takeaway was just the hunger that these peers have to come together and build a stronger community and stronger network of advocates. As I mentioned, we had such a diverse group of attendees. We had peers representing veterans, peers representing the LGBTQ plus community, peers representing the unhoused. And yet, even with this diversity, so many of these peers were sharing similar themes, similar challenges that they're facing, things like peers being devalued in the workplace, organizations pushing more of that medical model, um, inaccessible services, an increase in involuntary treatment among their clients. And it was just really clear that there was this hunger there to come together and um, advocate for themselves, for their communities. And um, I think I can speak on behalf of the whole team here and saying that we definitely felt a very strong sense in the room of just being stronger together. And that was just such a privilege to be able to witness that and be a part of that.
Mm-hmm.
Absolutely. So important. And just really an emphasis on like thanking them for being willing to share their stories with us because they know as a collective we can do something with those stories. So that was just really amazing to see. And it was really great to get insights from our people on the ground doing the work and experiencing the issues that we've been talking about firsthand. And while it's amazing to connect with them and be with them and talk about these things, it is hard to talk about the harmful things that are happening in our communities. And I think one story that really affected all of us was that there was an individual who attended and was recently at the time put on a 5150 hold and was never given a patient's rights advocate. They were forcibly held and medicated against their will. And really, they had gone to the hospital because they had been struggling with school and work, and their father was sick. So they had gone to the facility to see someone to help them sleep. And instead of receiving any kind of support or medication for that, they were put on a 5150 hold for at least a week with no patient's rights advocate. And you are supposed to see one within 72 hours. And so they were also finally given a hearing after a week of being forcibly held. And so the other issue was that their family had no idea where they were because they had gone in there for help sleeping and then were gone for a week. Um, so this happened at a hospital in Los Angeles. And according to this person, it was happening to someone else while they were there as well. So we can assume that there is a patient's rights problem in all of California based on this situation here in Los Angeles. And I think we need more funding for patients' rights advocates so that we can protect the due process rights of patients. And I think the hospitals need to be transparent with their patients because many people don't even know that they have the right to ask for a patient's rights advocate. And that's really important. People need to know that. And lastly, another key takeaway from the event would be that peers want more involvement in the community planning process and in the development of the integrated care plans. They want to be given opportunities to provide their meaningful input. And right now, we feel kind of left out of the process. The planning process is opaque and hard for peers to figure out where their input actually fits in. And that really needs to change because peers have extremely valuable input. And lastly, on a more positive note, the folks that joined us at the Los Angeles event all made it a point to connect as a network within their community, and they shared contact information with each other. We're making plans to form meetings and things like that. So that was really a beautiful thing to see to end our time there that day because we were hearing all of these stories that were just kind of like people having the same experiences with these harmful institutions. And so that was just really a great thing to see them come together and make a plan for what to do going forward to address those issues in their community.
Definitely. I have to piggyback off of that piece of really getting peers integrated throughout the system. They have the lived experience. Um, Aside from the ongoing training that they receive and professional experience that they're getting. And as peers, what they bring to the table as peers because they have been there. Um, and so, with my takeaway, I was connecting that a little bit with some resources that I know are available with the roadmap that was developed by the HEROES program with DHCS and the Sierra Health Foundation. One of the core components of that roadmap is integrating peers throughout the recovery continuum. And so looking at that as an opportunity for everyone to walk away through, whether we're in LA, whether we're in the Bay Area, Superior region, Central region, our Southern region folks, that's something that we are all going to be continuing to trying to find that way to make sure that peers are out there, that there's an awareness of the peer workforce and what peers can do to help advocate for individuals and keeping the client-centered approach through this transition, even though there is an emphasis and prioritization of that medical model. With peers, we can keep our peers client-centered, focus-centered, personalize the care to their needs, their strengths, what each of the peers have to bring, even through their own experiences and overcoming challenges that life is throwing at them. So since leaving LA to that point, we have peers who have been reaching out. And we're grateful that they took that message, whether it was being involved in the CPP. We've been hearing from LLEs being getting out there, going to those CPP meetings, and other peers reaching out to do things on their own, building within their own regions.
Yeah, that's been really inspiring for us to see peers mobilizing in that way. There was one individual in particular that attended who came back, emailed us right away, let us know what she was doing. Within days, she had sent out a newsletter to a group of attendees and was just really actively looking for ways for peers to support one another and to advocate with one another for one another. Um, and so I also want to add that if you are in LA, you weren't part of our event, but you're in LA and you're a peer or an advocate, reach out to us because we can connect you with these individuals. And I know they're looking to grow this network of peers. So reach out to the Access team if you're in the LA area, and we would love to get you connected
Yes.
with advocates down there.
Yes. Thank you for saying that, Joss.
Yeah, we're constantly growing our network too.
Yeah. Exactly.
We also have met with our LLEs in the Superior and Bay Area regions to finalize plans for their upcoming events in Red Bluff and Oakland. And they're looking forward to continuing this vital conversation and the impacts of the BHSA within their communities and their regions.
Yeah, so we are heading up to Red Bluff in a few days, actually. And I'm really excited just to go to a rural region after being out in LA. Um, Going from urban to rural, I think that'll be really interesting, just to engage in conversations in a very different setting. So we'll be there in a few days. After that, we'll be in Oakland on October 1st. And the deadline to register for that event is September 21st. Then we're going to head down to Orange County to Costa Mesa on October 16th. And so if you're in Southern California and you missed the LA event, you can sign up for that one. That deadline is October 6th. Lastly, we will come home to Sacramento on October 30th. And the deadline to register is October 20th, but that one is filling up very fast. So if you're here in the central region with us, please reach out soon so you can be part of that event as well. And we'll leave the links in the episode description for you to be able to sign up. And then if you're not able to come to an in-person event, we also have virtual events coming up. On September 25th, we are co-hosting a training with Legal Services of Northern California. And that training will provide an overview of the Medi-Cal appeal and state fair hearing systems with a special focus on how to access mental health care. On October 9th, we will have our next policy update webinar where our policy director, Maron, will share the latest updates on current legislation and the impacts. And then mark your calendars for January 23rd, 2026, which I think is coming faster than we realized, the annual statewide conference. And then just keep following us through our newsletter, through our podcast. We do our best to keep you up to date with the legislative information and occasional calls to action so that you can join us in advocating when you feel moved to do so. We'll also be adding polls to our social media. We want to make sure that your voice is incorporated in these podcasts and in what we're talking about. So keep an eye out for those, engage in those polls with us so you can be part of this conversation as well. And then share this podcast with your friends and family. We want to get this information out to the people that is impacting the most.
Yes, thank you, Joss. So we are also preparing to go live with a new advocacy platform called Every Action so that we can provide a more streamlined process for reaching out to your local, state, and federal representatives. So without getting into the weeds of all of that and how that works, just please keep a lookout for those announcements. Those will be coming from us. And then also join us next month as we discuss more about advocacy, client engagement, and shared decision making. We love having these conversations and sharing with all of you the insights that we get from our community members. And we just want to keep those conversations rolling. So stay connected.
Thank you. We'll see you next time.
Thank you. Bye.
Bye.